Hi, my name's Allison. I'm going to be facilitating our discussion today about appropriate communication between an occupational therapist and their patient. So today our presentation is going to be about a range of motion exam that an OT will often do with a patient. This presentation is aimed at students, or you could also use it with practicing OTs as kind of a refresher course as well. So just some background, appropriate communication is a critical element in the relationship between a healthcare professional and the patient. A patient's perception and understanding of the healthcare received is based on effective communication with that healthcare provider. Additionally, the health of the patient is more likely to improve if the patient understands and adheres to the treatment plan provided. Does that make sense so far?
Yeah.
Okay. An occupational therapist must engage the patient in conversation during the treatment session to ensure the patient's comprehension of the treatment plan and objectives. Therapists must remember the necessity of using appropriate language. Most patients won't understand medical jargon. It wouldn't make sense to tell your patient to use adduction or flexion. That would just go right over their head. Additionally, the therapist must maintain professional boundaries and treat the patient with respect. Think of if you were in the exam, you would want your doctor, therapist, what have you, to treat you with respect. So this presentation will first demonstrate a poor example of communication between an OT and a patient. So you guys will observe the interaction, try and think of the topics that we just talked about, and take notes so that we can discuss the good and the bad. So once we view that, we're going to talk about the poor communication, maybe anything that the therapist did well. We can kind of pinpoint how those methods can be improved. All right, do you guys have any questions before we start? All right.
Come in.
Hey, okay, so we've got some shadows here with us today.
Okay.
All right, bear with me. Late night. So what we're gonna do, we're gonna bring your hand into flexion, or your elbow, excuse me. So there's gonna be supination of your forearm, with the roller side of hand touching the acromioclavicular joint. So keep your arm adducted. Okay. Okay, and then put your arm like this.
Oh, that's what sort of.
Oh, I'm just gonna push it a little bit more.
Okay, that's pretty painful.
Okay, we're done. Great.
Okay.
So according to this, it looks like you've lost a lot of the range of motion in your arm.
So what does that mean?
Do you use it for a lot of things during the day, like ABLs or?
I mean, I work with both my arms.
We might have to work on that. Do you have any questions?
Yeah, quite a few.
Okay, well, our time is up, so if you could just make an appointment, that'd be great.
Should I be nervous about this?
I would be.
All right, so now we're back from watching the first interaction between the therapist and the patient. What are some of your initial observations based on the introduction that the therapist provided?
Well, I kind of thought there was a lack of an introduction. And when she walked in, she didn't even introduce herself to the patient or introduce us to the patient, which I thought was kind of uncomfortable for us, and I can imagine was uncomfortable for the patient as well.
Absolutely. That's an excellent point to remember when you're practicing is if you have someone shadowing with you, you always want to get the patient's approval that that's okay and introduce so that the students or other healthcare professionals don't feel uncomfortable and so that the patient doesn't feel comfortable. What else did you notice?
She didn't explain the procedure or the tool that she was using.
And why do you think that that was important for the patient?
Just to put the patient at ease.
Yep.
And she also didn't ask if he had any questions.
Yep, good
Which
point.
would also help put him at ease.
What do you think?
I just felt like the whole thing was it all happened really fast. So yeah, there wasn't much of an introduction, and it almost seemed like she was more concerned about just getting the job done. And I know that's like part of an OT's career is just that you're always on the go, but she wasn't really picking up on the patient's reaction. So he seemed a little bit confused at times.
Yep. So thinking of all these points, would one of you like to provide a good introduction that would be better?
Okay, if I was the therapist, I'd walk in and say, "Hi, I'm Kelly. I'm going to be your therapist today. I have some students shadowing me. Is it okay if they watch?" And then if he said okay, I would have them sit down and I'd tell him what the test was, say that we're going to measure how much you can move your joints, and that the point of this was to help plan the treatment for him. And I tell him this is a goniometer, it's the instrument I'm going to be using to help measure the motion of your joints, and that it's just like a large protractor that I'm going to put against your body and it won't hurt at all, and ask if he has any questions.
That's great. Clearly you've seen the negatives of the first one and we're able to apply our discussion to create a more positive interaction. Well done. All right, now let's discuss the range of motion procedure that we saw between the therapist and the patient. Just as with the introduction that we had discussed, I want us to go through the pros and cons of the interaction and pinpoint the positive and negative aspects.
I thought she was using too many technical terms, and then it was hard for the patient to understand what she was talking about. And she also didn't seem knowledgeable because she was reading from the chart and told him to adduct and had him abduct his arm.
That's a good point. Patients won't understand terms such as flexion, extension, abduction, adduction. Good observation.
No, I felt the procedure was a little confusing, not only because of use of technical terms, but I thought it would have been really helpful if she would have demonstrated the motion that she wanted the patient to do before she just started moving his arm around and jumping straight into the procedure.
That's a great point. Another point to add on to that is she just grabbed the patient's arm. She didn't ask him if that was okay. As we talked about as I talked about in the beginning introduction, you want to treat your patient with respect and let them know what's happening at all times. So if you need to touch the patient, you're going to say, I'm just going to put my arm on your forearm, your shoulder, wherever it is, so the patient knows what's going on. Any other points?
Yeah, going off of that, I noticed that the patient seemed like he was communicating that he was in pain when she was moving him, and she just didn't respond to that and kept moving him just to see if she could get better results. So she didn't really pick up on his pain.
Exactly. You always want to be aware of, nonverbal communication. We'll discuss that more towards the end, but good point. Would anyone like to give an example of how you would carry out a good procedure?
Yeah, I could.
Okay.
I think that after I approached the patient and explained what the goniometer was and the tools I was using and the procedure, I would have done the motion that I wanted him to do so that he was completely on the same page and knew exactly what I was measuring for. And then I would have made sure that he was capable of performing that motion. And then after asking him if it was okay if I touched his arm so that I could measure the angle of his range of motion, I I would have measured with the goniometer, and then once I picked up on the fact that he was in pain, I would have stopped and checked back in with the patient, and then seen if I could maybe get a little bit more motion, and if I couldn't, stopped and then continue with the rest of our visit.
That's great. It seems like, as with the introduction, you guys are really putting the pieces together that we're discussing and that I'm mentioning, so I'm really happy so far. All right, the last aspect of the procedure that I want us to discuss is sort of the conclusion when the therapist is going to relay the results of the exam. So let's talk about some of the pros and cons that you saw during that part.
Well, I can imagine that getting results of an exam can be kind of nerve-wracking for a patient, and the therapist didn't really make any attempt to try to connect with the feelings that the patient might be having or show any form of respect for the patient and the emotions that he might be going through. And I also just felt like there was a real lack of empathy in the interaction between the therapist and the patient, and that she wasn't trying to understand his situation or try to connect on that level at all.
Absolutely, you're completely right. I think an essential part of being an occupational therapist is really establishing a relationship and a rapport with the patient. You need to understand their motivations, their personalities, and how you as the therapist can best interact with them to provide them with the best care. So not showing empathy, saying I'm concerned with his anxieties, a huge problem.
I also thought that she was really blunt with the results, and I thought it was really inappropriate when she said she'd be nervous too.
Yeah, it was. It's funny, but it's true.
Yeah.
Totally inappropriate.
Like, maybe that was her form of trying to be empathetic, but it didn't come off that way at all.
Absolutely. Good point. What else?
I picked up on the fact that she asked the patient if he had any questions, and he did mention that he had some, but she noticed that her session was up and she had to move on. So I felt that ended abruptly and it wasn't very professional.
I totally agree. That was completely unprofessional. So having said all of this, would someone like to do a final example of how they would conclude a range of motion evaluation?
Sure.
Okay.
If I were the therapist and I gathered the data of the patient's movement, I would be honest, but I wouldn't try to conduct that in a way that would make them uneasy. I would tell them that lots of people have had this problem before, and that there's a chance that even just in the meantime, we can use adaptive methods to still function. But that with this data, I can then plan a really good treatment plan to gain that back. And I would absolutely make sure that his questions are answered before telling him to schedule another appointment with the secretary.
I think so too. That's a great example. You want to leave on a good note. You want your patient to feel confident in their, prognosis and whatnot. So, great example. All right, now let's go ahead and put together everything that we've just learned and discussed, and we're going to go ahead and watch good communication between a therapist and a patient during a range of motion exam.
Come in.
Hi, I'm Katie, and I'll be your occupational therapist.
Scott?
Scott, nice to meet you. First request, I have a few students shadowing me today. Would you mind if they're in the room?
Sure.
Certainly.
Hi, I'm Emma.
Scott.
Nice to meet you.
I'm Kristen.
Scott.
Hi, I'm Kelly.
Scott.
Nice to meet you.
And Scott, have you heard of occupational therapy before?
I have not.
So we're going to make sure that you're safe to do things like brush your teeth, get dressed in the morning, and anything else that you like to do during the day. So the activities that you do are actually called occupations, is how we refer to them. So we're going to make sure that your arm and your elbow is ready for the things that you want to do and get you back to work. What do you do, or how did you injure your arm?
I work in a factory for auto parts, just stocking the shelves, and one of the boxes fell off, and I went to grab it and just hurt my elbow.
Okay, and who do you live with at home?
My wife?
Do you have people that you care for, or any kids?
No kids.
Okay. All right, and the first thing you're going to do is do a range of motion test to see how your elbow and your arm is moving. This is called a goniometer. It's kind of like an extended protractor, and it isn't going to be painful at all. It's just going to help me learn how your elbow is moving.
Okay.
Do you have any questions?
So how are you going to measure that? Like, where are you going to put it?
I'm going to put it on your elbow. If you don't mind, I'll just touch it with my hand.
Okay.
So when you stand up, so you're going to make a motion just like this, moving your hand up to your elbow or your shoulder. Excuse me. Can you do that for me?
Yeah, sure. Okay. So like this?
Mm-hmm.
Alright, that's about as far as I can go.
All right. And on a scale of 1 to 10, what would you say your pain is?
Probably about a 3.
All right. Let's get started.
So we put it down?
Yeah, put it you straight down to the floor. Okay, Scott, and can you show me that motion one more time? Just hand up to the shoulder and relax. Great. Now I'm going to do the measurement. I'm just going to hold on to your arm and I place the goniometer. Okay, move your hand up to your shoulder.
That's about as far as I can go.
Okay, and I'm going to move it myself and just let me know how far it can go.
Okay. About right there.
All right, and you can relax. So Scott, the exam showed that you do have some more limited range of motion in your arm and your elbow than before the injury. So we're going to talk about just how we're going to go about developing a home exercise plan for you and communicating. Definitely we'll keep the lines of communication open to figure out what you want to do at home and where your limitations are. For now, we're going to work in a pain-free range I know you had some pain when moving your hand up to your elbow. So in the beginning, we're definitely going to work in a range where you're not experiencing any of the pain. Do you have any questions about your treatment?
How long is it going to take before my elbow is better?
Sure. It can really vary. I've seen some patients, in as few as a couple of weeks that aren't feeling any pain and can go about a lot of their activities, and for others it can take longer. So it really depends on your goals and where you are and how your arm is healing.
Okay. For those other patients you had, what were the timelines for them?
Well, we'll start you with the 3 times per week therapy. So then it will kind of determine from there. I'll be seeing you very frequently. We'll figure out how long it'll take to get you better.
Okay. Am I going to be just seeing you or another therapist?
You may see other therapists depending on what works best with your schedule, if you're free during the days or the evenings. So it'll depend, but anybody here will be very familiar with your treatment plan.
Okay. Do I have any limitations when I go home? Like, do I have to keep it, can I move it at all, or do I have to keep it immobile?
I would definitely, you can go about your activities as long as you're not feeling any pain. And we might give you some adaptive equipment to make it easier. Other than that, I'll definitely have more and less activities that you can do depending on how you are when we see you each week.
Okay. If I have any questions during the week, like when I don't have an appointment, can I call and talk to somebody or?
Oh yeah, definitely. Call our office anytime.
Okay.
Any other questions?
No, not at this time.
All right. Well, it was great to meet you and look forward to working with you.
Okay, great. Thanks.
Right, now that we have just finished watching the good demonstration between the therapist and the patient, I just want to touch back with the three of you and see what your observations were, especially in comparison to the first demonstration. Would anyone like to start?
Yeah, just when she first walked into the room, I thought it was really great that she introduced herself to the patient and he knew exactly who she was and why she was there. And then she asked the patient if it was okay if we as students could come in. And then she made sure that after this was okay, that we came in and introduced ourselves to the patient.
Yep, much better than the first bad example. Anything else?
Yeah, she also explained the test to him and what the instrument was, the goniometer, and she also made sure that he understood what occupational therapy was, because a lot of people don't know or are confused by what an occupational therapist actually does.
Yep, that's a great point.
I especially like that she checked for the patient's understanding, just when explaining everything, that he actually understood everything that was going to happen.
Yeah. Any other points that you'd like to add? I agree. I think overall, the good demonstration really shows the importance of good communication, both verbal and nonverbal. So great job being able to compare the two. Now I'd like us to discuss the procedure, so the actual range of motion exam that we just observed using good communication strategies. Any observations?
Yeah, different from the first time, she actually demonstrated the motion that she was going to be doing while she was telling him what motion it was, so he could not only understand it in words, but actually see it too.
She also communicated when she was going to touch him with both the goniometer and
Absolutely.
And then I noticed that, as opposed to last time, she was really cognizant of the patient's pain level and was paying attention to his nonverbal and verbal cues of what he was comfortable doing, and just made sure that she didn't push it too far into too much pain.
Yeah, great observations. Now, just to finish up our discussion, what were your observations about the results portion of the good communications range of motion exam?
Yeah, I like that she explained the results. So he initially understood why she was doing the test, but it's important also for the patient to understand what the results of the test means and how that applied to his therapy.
Yeah, great point.
And kind of going off of that, I thought it was great that she made it very clear that with that information, she was going to develop a treatment plan, and she was kind of asking him questions and making him feel like he was part of the development of that treatment plan and taking some of his personal factors into account.
Yeah, I also going off of what Emma said, like how she asked questions to him and made sure that he understood what was going on so he felt comfortable and didn't just run out of the room like
Right.
the last time.
Right. Great. Based on everything that you said, I'd say that you all did a great job understanding the differences. So thanks for your observational skills today. Alright, so now that we just finished watching the good example of communication between the occupational therapist and the patient, I think it really highlights the difference between the first demonstration where there was poor communication, because in this second example, the therapist really strove to create a relationship with the patient. She developed a rapport. She asked about his injury, his interests, and explained how those would affect his daily activities and his life. The patient seemed much more comfortable. She went through everything that she was going to be doing. She explained the procedure. She explained the goniometer. She paused to ask questions, or to let the patient ask questions, and provided answers to his satisfaction as well. Most importantly, during the results, she really took her time. She didn't run out of the room. Like, we had all agreed that was pretty unprofessional. She, again, was able to answer his questions. She made sure that he was comfortable in the treatment options and that he left feeling that he would get better, that his prognosis was going to be positive. So just to really summarize, I think we should leave here knowing that as an occupational therapist, we really want to treat our patients with respect. We want to provide as much information as possible and explain everything that we're doing. Remember to always think of your patient as a person. That sounds so silly, but it's easy to get lost in your goals during the day and whatnot. So at the end of the day, just remember how brief that is, or how simple that is. Your patient is a person, and treat them with respect. So in conclusion, thanks so much for watching our video. I hope you're able to take away some of the good communication strategies and able to compare the good with the bad. Have a great day.
That's why I made you corny.